Why is it important that we recognize these symptoms early?
Right. So the treatments that we have in someone that's having an acute stroke, which means that you're having the stroke right now, are time dependent. And the improvement that we see is based upon how quickly we can get that artery opened up. If it's an ischemic stroke, there's a blocked artery, we need to get that artery open and blood flowing through that artery to get you better.
Can you open it?
Well, we can. There are things that we have that can try to get that clot out of the artery.
So you said get there fast. How fast are we talking about? So if somebody has these symptoms, the weakness, the numbness, the slurred speech, the face drawing, can't see good, how much time do we have?
As quick as possible. The treatments are time-based, but the sooner you get that blood vessel open, the more likelihood that you're going to have a good neurologic outcome. So some of the treatments that we have, we can't give 6 hours, 8 hours, 12 hours later.
That quick. So you've got to get there really. You can't go, well, I'm going to wait till tomorrow and see if it's really that. I'm not really sure.
Absolutely. The sooner you get there, the more effective our treatments, the more chance you're going to get that treatment, and the better that treatment's going to work ultimately.
So is it important when somebody has these symptoms that when they get to the emergency room quick, can they jump in a car and have somebody drive them? Do you need the ambulance? Is there anything that the ambulance can do?
Call 911.
911 immediately.
Absolutely. And when you talk to the dispatcher, mention the symptoms that someone's having, what kind of deficits they're having. Make sure that you mention, I think someone's having a stroke. And that will trigger that pathway, that stroke pathway. And the paramedics will come out, they'll initiate their treatments, they'll call the hospital oftentimes before they even get to the hospital and say, hey, I have a person that's potentially having a stroke. And what happens at our hospital, we get our stroke team together. We get our stroke team together before that person even gets to the hospital. And so that way we can initiate that evaluation and see if that person's a candidate for treatment.
I think the thing that's most important is that early recognition of sign. Is there sort of a mnemonic on that?
Yeah, the mnemonic is FAST, and that stands for face, arm, speech, and time. So as I mentioned earlier, look at the face. Have them smile. If it's droopy, you get a point. Have them lift up their arms. If there's one that's drifting a little bit, that's another point. Have them say a phrase. You can't teach old dog new tricks. If it's slurred, or if they can't speak, or if they have difficulty comprehending, that's another point. Any points, T is for time. Call 911 and get those paramedics out as quick as possible.